Okay. Or environmental related, okay, emergencies. Okay. So these are emergencies that come from the environment. So for me to make this clearer, I'm going to draw 3 different sections on the board. Okay, 3 different sections, and I'm going to label them differently. So I have hot here. So this is a hot region. Let me use blues. Blue as cold region. So cold region. And then I'm going to use black as normal region. So those are the 3 divisions that I will use to make it clear. So you have this region, you have this region, you have this region. So let me start from the normal. So using the body temperature. So that's actually what I'm using. Okay, if you take a thermometer, and then you take your temperature, the normal body temperature. So you should get something like 36 degrees Celsius to 37 degrees Celsius if you want to just use the whole number. And that is normal. This is where your body wants you to be. So when your body temperature is here, is normal, every part of the body is working. Okay, every part of the body is working well. The brain, the eyes, everybody is happy because that is normal. So if you step out of this and go to a cold environment and you spend some time there, the temperature will reduce. So it drops. So the temperature of the body will drop. If you go to the hot place and you spend some time there, okay, the temperature of the body will increase. It will go beyond that acceptable limit, okay? And then you may begin to experience some emergencies here or here. So there are emergencies, that's what we mean by environmental related. So those are emergencies relating to the environment, okay? So over here there are a few of them that we're going to look at briefly, just a general review. So you have what you call hypothermia. So hypothermia is an emergency that you have to grapple with when you go to a cold environment. So hypothermia means body temperature that is below normal. Below normal is hypothermia. Hypo means below, lower than normal. Of course, thermia means temperature. Okay. So over here, depending on how long the person stays in that environment, it can go from mild. So initially it will be mild. Okay. And once that happens, once there is a departure from this normal, to lower temperature, your body will know, and your body will tell you right away. And one of the ways your body tells you that, hey, you have gone out of the acceptable temperature is by shivering. You begin to shiver. And shiver, the objective actually is your body. Your body is not trying to heat your body up. So shivering is muscle activity, and it is intentional. Initially, your body wants, because of that drop in temperature, so shivering, you begin to shiver, Okay, so begin to shiver, and that is meant to push the temperature to the normal, because that shivering activity has it heats you up. Okay, so it's a way that the body tries to push you back to the norm, because it doesn't want that drop. Because your body knows that if the temperature keeps on dropping, that is going to be disastrous at some point. So it is helping you to push it back to the normal to shivering, the heat that it generated. Okay, so that's the intention. So initially it will be mild, and this is where the signs and symptoms, shivering will start, and every other thing may be normal. It's only the shivering that you begin to notice. Okay, but if you spend more time in that environment, it will move to moderate hypothermia, moderate. So that means more serious, and that is when your brain, the heart, the lungs begin to feel it. So that means the code is not penetrating, it's reaching the heart. The person begins to make even wrong judgment, the breathing will be affected, the heart will be affected, because that code is really getting deeper and deeper, and temperature is dropping further and further, and that is not healthy for the systems, the body. It's not good at all. So, and then the shivering may intensify. So the person may now begin to shiver, the mouth, everything is shivering, it becomes more serious shivering, right? So, but if the person continues, for whatever reason, the person continues, it will now enter the severe hypothermia, which is very deadly. So at that time, the temperature had dropped. So if you take the temperature in the body, it may be maybe 3 degrees Celsius less than normal, or 4 degrees Celsius less than normal. So the person will really be in crisis at that time. And if the person is not hurried out of that cold environment, if somebody is not taken away, you are looking at dead end there. The person may eventually die, because at that point, the temperature is so low for the brain to function. The temperature is so low for the heart to function, because for the body to work properly, this is the temperature we need. So when the temperature is about, and we're talking about internal temperature, so don't mistake this. This is not environment. We're not talking about environment. We're talking about inside temperature. Inside temperature, that's what we call normal. Okay? So this is very, very... So the first aid, actually, what you do, the first aid for any of these is move the person away to this temperature. So that is the first thing you do. You need to move the person away from that cold environment, and then give the person something like warmth. Okay? You can give the person warmth, something warm like tea, coffee, soup, blanket, anything, even heat. But that is what you need now. You need to leave that environment and then warm the person slowly. Okay, warm the person slowly. That is what the person needs. Okay, so that is hypothermia. Okay, so another emergency that may happen from the cold environment is what we call frozen state. Frozen. So frozen state. So this is when the person is frozen from head to toe. This happens during the bad winter time. Bad winter time, when the weather is so cold and for extended period of time. And some of the people that are homeless, that sleep under the bridge, they don't have any place. They carry the blanket with them, but the cold is too much. For extended period of time, these people can get frozen completely, not have fish is frozen in the freezer. That is how it is. In fact, the body is just like a rock, like a stone. Okay, and of course that is 911 call because there is not much you can do at that time because the body is hard now. Okay, so it's a 911 call. So this is a extreme case, but it happens. It happens during the cold weather. So some people actually experience this. I don't know how many people survive. I don't know. I've never seen any before, but it happened to some people. So the third one we're going to consider on this area is what we call frostbite. So frostbite is also a common experience. I don't know whether you have had it. Has anybody had frostbite before? So frostbite happens when the skin begins to freeze. Okay, especially during winter. Some of the areas that you don't cover properly, you begin to experience frostbite. Your finger, your ears, the tip of the nose, all those areas, the feet. Those are some areas. So frostbite happens when the skin begins to feel it. When the layers of skin begin to freeze. There are two types of frostbite. There are two types. One is called superficial frostbite. Superficial frostbite. And the other one is called deep frostbite. Those are the two types. Okay? Superficial frostbite means that the 3 layers of skin, remember we have 3 layers of skin, epidermis, okay, remember epidermis, okay, is the outermost skin layer, and then you have the middle one is called dermis, and then the third one is called hypodermis. Okay, hypodermis. So those are the 3 layers. So if freezing begins, somebody is in the cold for maybe you're waiting for bus, it's a very bad winter day, you are using public transport, you go to the bus station because the roads are bad and drivers are not coming, the buses are broken down, they're slippery. Usually it takes 15 minutes, now it's taking an hour plus, and you are there waiting and you didn't dress properly, and then you begin to feel your skin begin to freeze. So superficial frostbite happens if these 3 layers are frozen. So if the freezing gas starts from the epidermis and then it moves to dermis and then reaches the hypodermis, but it has not entered the inside yet. It has not entered this one is called superficial. But if you stay there longer, and then the freezing continues and then enter the tissue underneath, where you have blood vessels, where you have nerves, so where you have blood, so it's not inside, where you have even muscles. Okay, so it has entered, it has gone beyond the 3 layers. So this is called deep frostbite, deep. And if you feel that area is like stone, you can't even depress it. You can't, because it's very hard. It's very, very hard now because all the layers and the tissues behind are now frozen. Okay, and that is very, very dangerous because the nerves are frozen, the blood vessels are frozen. Somebody can actually lose that part of the hand if care is not taken. If the person does not leave the environment, sooner than later, the person may even lose that part of hand. So that is and the first aid for this is, again, the person must leave that good environment. You must leave, and then you need to rewarm. You need to rewarm that. And when this happens, of course, the person is numb. That area is numb, you won't feel anything. You hardly can feel anything, depending on the extent that it has gone. You may not feel anything. As a matter of fact, they can pour hot water on that area, you won't feel anything. Remember that the nerves are the conductor of message to the brain. Yeah. The nerves. So if the nerves are frozen, that message is not going to reach the brain. So you can actually burn somebody without the person realizing. It is later that the person will begin to feel the pain. So that's why in the book that we use, it is recommended that when you are rewarming the person, be careful not to use hot water. Never use water at a high temperature. In fact, it is recommended that you use, if you are rewarming, use water at 37 degrees Celsius to 40 degrees Celsius. So this is the level of warmth, okay, that you must use. Don't go beyond it because you can burn the person without the person realizing. So that is what we are going to consider on this part. Okay. Now we are on this part. Let us go on the part of hotness. When the weather is hot, of course, Canada, the weather can be so cool sometimes, and other time could be so hot. Okay, so somebody may have this during winter time, and when it is really, really hot, somebody can also have that. Okay, remember, please ask me a question if you have any question. So when somebody is in a hot area, the temperature begins to increase. For sure, it's a matter of time. It's a matter of time. It's not even negotiable. Okay, it's a matter of how long and soon. So now let me ask you, when the temperature of the body goes beyond the normal, how does your body tell you that that is the case? Sweating. That is natural and that is automatic. Once you step out of the normal and to the hot area, and you stay there for some time, and the temperature goes beyond this, your body will know. Your body will sense it. And your body will not just fold the hand and be watching, because you know that this is dangerous. So your body will initially try to oppose that increase by sweating. Sweating has cooling effect. When you sweat, it cools your body down. So that is intentional. Your body is fighting back. So sweating. So the person begins to sweat here. So sweating starts. And the intention is to push the temperature back to this through cooling that comes from the sweating. Now, when you sweat, what do you lose? When you sweat, what do you lose in the process? Salt. You lose salt. What else do you lose? Water. What else do you lose? One more. Electrolytes. Electrolyte. So, now let me ask you again. Are these three elements important for our body? Are they important? Yeah, so the answer is yes. They are important. So what that means is there's what you call bittersweet. This is like bittersweet. So bitter because you're losing this, sweet because your temperature is being pushed back. So in the process of helping you, you also